want to thank everybody for the generous introduction and for the amazing stay that I've had over the last week. You know, I'll add that the Bindra name has gained some notice even in the States due to Abhinav's success. Many have come up to me asking if I know him, and I just say he's my cousin, and I leave it at that. You know, he's not my cousin. Really what kind of revolves around improving our chance of a better outcome is just doing what we can to be active. And it doesn't necessarily mean having to go to the gym and do something really off the wall. It means basic walking in my mind. You know, even if we're just talking about doing like 30 minutes of brisk walking or to whatever degree we can several days a week. I think even that's enough. I suspect that there is some answer that lies within diet as well to impact our immunity. And I wonder whether some of that will become much more known as time goes on, as more is studied. And some structural abnormality in the heart that would lead to sudden cardiac death. It's not going to be just because I had COVID. Potential cardiac involvement with the virus and post-virus. Sudden cardiac death, of course, is something that's going to be extraordinarily intimidating for all of us. And now with Navratri coming around the corner, I can understand the basis of the question. But really nothing more than just screening. You know, we're kind of sometimes, you know, if you find ECG abnormalities, then that would further work up with a bedside echo, which would usually detect a lot of the pathology that would lead to sudden cardiac death. But short of that, you know, I think that continuing to live our lives while respecting our health is really the best guidance there. But baseline ECG would be enough to kind of get the ball rolling. I think screening is, you know, the far and away the most important tool. And now how do we reach those remote parts of India, those villages where, you know, getting access, physical access to the village is tough enough, let alone actually having a really detailed accounting of where specific individuals are and accounting for them. You know, that's a challenge that I think has been going on for a long time. You know, we were talking about this maybe last week, but, you know, the spread of TB when you have crowded train stations, somebody's infected, somebody's actively spreading disease. You know, that density doesn't really happen as much there. But to get back to the root of the question, a focus on screening, and that focus on screening has to be on even just basic infection, and it has to be something that comes not just from the hospital, but it has to be a firm initiative from the government and put in the resources. ILD is very different than asthma. ILD is what it stands for is interstitial lung disease, but it's scarring of the lungs. Okay, it's actually causing loss of lung tissue. Asthma, for all of the issues that it has, it causes the airways to tighten, but not necessarily scar the lungs. People with asthma can have totally normal lung function because during those times their lungs are normal. When they have attack, then inhalers would help reverse the attack. Interstitial lung disease, you will not have completely normal lung function studies most of the time because there's loss of lung tissue. The incidence of ILD is going up in India, in Nagpur, but there are studies out of Chandigarh. Really, there's a lot more information coming out about it. Some of it is just better access to care. It's getting recognized more. Maybe it's existed, but it's getting recognized more. But the other major factor in India, the so-called elephant in the room, is really air quality. And the impact of air quality on our lungs, and particularly in causing interstitial lung disease, is something that, as we get further and further down the line, is something that's going to have to be reckoned with. And I really think that, within interstitial lung disease, there's so many different categories. There's something called hypersensitivity pneumonitis that's much on the increase in India. Sarcoidosis is one of the other bigger causes. And I can go through all the technical parts of what all these diagnoses mean, but really the common thread is that, air quality. And that really seems to be causing a big part of the increased incidence. That I've been practicing for some time will remember the H1N1 very, very vividly. We saw a lot of young people. It was right around 2008, kind of infected in our ICUs, pregnant patients. Really, the impact of that will remain in many of our memories for a long, long time. And I think it's really, there's been a couple of questions now, one about tuberculosis and now this about H1N1, that kind of remind us that we need to always focus on the basics as well as whatever other challenges may come before us. And the flu vaccination is something that we really, really emphasize, and I know it happens here as well, but we really emphasize aggressively there. There's definitely much more receptiveness to the flu vaccine than there is to the COVID vaccine in the States. And I think really, short of anything else, that has to be the major impact, is continuing to emphasize vaccination